According to the World Health Organization, every 2 minutes, somewhere in the world, nearly 30 young children die from preventable diseases. In developing countries such as Botswana and Nigeria, maternal and infant mortality rates have declined. Yet in South Africa, the economic powerhouse of Africa, we are struggling to meet our Millennium Development Goals. 1 in 18 children under the age of 5 die from diseases such as diarrhea, meningitis, TB, and HIV each year. Each death is one too many. The time for action is now. Every Thursday afternoon at selected Clicks clinics throughout South Africa, little lives are receiving large boosts. Life-affirming vaccinations immunize tiny bodies against dreaded disease. And with the help of our nursing experts, mothers are monitoring their babies' development to ensure they have thriving babies. Mothers are also empowered with solid practical advice and guidance on how to best feed their babies and plan their families. Clicks believes that every child deserves access to healthcare, advice, and vaccinations to help them grow strong and healthy. That's why we established the Clicks Helping Hand Trust, to give mums and babies a helping hand when they need it most. Right now, in South Africa, it costs over 3,500 rand in vaccination medicine alone to immunize one baby for the first 18 months of its life. The Clicks Helping Hand Trust provides free baby vaccinations, baby wellness and nutrition advice, and free family planning at selected Clicks clinics nationwide on an appointment basis for moms whose babies were born at state facilities and families that have no access to medical aid.
We are extremely pleased to have grown the Helping Hand Trust to over 50 clinics in all 9 provinces over the past 18 months. During this period, our nursing practitioners immunized over 11,000 babies, as well as provided moms with family planning and healthcare advice. At Clicks, we have the infrastructure and national footprint to make these services available to all South Africans. We look forward to extending our Clicks Helping Hand Trust locations to reach more and more mothers and babies in need.
It's every child's right to be immunized against disease and every mother's wish to have access to quality health care when their child needs it most. Since the trust was established in February 2011, Clicks has donated service fees and nurses' time to almost 250,000 rand and dispensed almost 5 million rand worth of medication for free. Clicks donates the clinics, qualified nurses, consumables, vaccinations and family planning medication. Stock donations are received from government and cash donations from sponsors, which we allocate exclusively to buying the vaccines. By allocating 5% of the proceeds of Clicks branded baby products to the Moms and Babies initiative, we're involving our customers too. They too can feel good, knowing they're helping to improve the health outcomes of fellow South Africans.
A big thank you must go out to all our customers for purchasing Clicks branded baby products in support of the Clicks Helping Hand Trust. I am especially grateful to everyone at Clicks and our donors, Nestlé, Procter & Gamble, Unilever, Pharmacodynamics, Comed Health and the Clicks Foundation, who helped to launch and build the trust in its first 18 months. It is very rewarding to know that between us, we're making such a tangible difference in supporting the communities in which we operate.
The more funds and support we raise, the more we can roll out life-saving vaccinations across Clicks' nationwide footprint and help South Africa decrease our infant mortality rate. We are actively campaigning for sponsored medicine supplies from government, as well as donations from corporates and foundations to extend this vital service across South Africa. We are pleased to have entered into an agreement with the Western Cape Department of Health to provide free vaccination stock for Clicks clinics situated in the Western Cape, which will be distributed through UPD free of charge.
We thank the Western Cape Department of Health for their support, and we look forward to working hand in hand with national and provincial governments to grow the reach of the Helping Hand Trust in the Eastern Cape, KwaZulu-Natal and Gauteng. By working together, we are committed to supporting the government in achieving our country's national priorities and the Millennium Development Goals.
Most of my patients, they come from disadvantaged communities. They live in shacks. Some of them, they don't have money. Some of them, they are just poor communities. So they were thrilled to hear about the Helping Trust. They feel that privacy is there and confidentiality, so they can explain more about their situations.
They're always happy with the service. They don't have to wait long in queues. They don't have to take off from work. So it's in and out, and they do make appointments. When the mom comes in, I do the baby weight, consultation with the baby, and also the baby injections. I enjoyed making a difference in the community where I work because it's a pleasure working with children.
We have a vision of a South Africa filled with the laughter and achievements of healthy children. An African prayer says, "Let us take care of the children, for they have a long way to go. Let us take care of the elders, for they have come a long way. Let us take care of those in between, for they are doing the work." A strong, healthy South Africa is right here within reach. We invite you to feel good too, to reach out your helping hand, share our vision and bring it closer as part of our commitment to making quality primary healthcare accessible to all.